Hello, and welcome to the EPSDT Fundamentals presentation. I'm Daniel Bankson, the Program Manager for the Physicians and EPSDT programs at Alabama Medicaid, and I will be guiding you throughout this presentation. EPSDT stands for Early and Periodic Screening, Diagnosis, and Treatment. For detailed information pertaining to the EPSDT program, refer to Appendix A, EPSDT, in the Alabama Medicaid Providers Billing Manual. During this presentation, we will discuss the core components of the EPSDT program. Each component is aimed at promoting the comprehensive well-being of Alabama's children. These components include the goals of the program, the different types of screenings, the critical components of screenings, follow-up visits, verifying recipient eligibility, metabolic newborn screenings, early intervention, and vaccines for children. The goals of the EPSDT program are multifaceted and underscore the commitment of ensuring that children receive a full spectrum of healthcare services tailored to address their developmental, physical, and mental health needs. The purpose of the EPSDT program is to identify children with actual or potential health problems and to screen, diagnose, and treat the problems before they become permanent lifelong disabilities. The program also offers preventative health services to Medicaid-eligible children under 21 years of age. The EPSDT program presents a range of benefits crucial to the health and well-being of children, encompassing early identification and intervention, expanded treatment services, and family education. EPSDT screenings fall under several broad categories: initial, periodic, interperiodic, vision, hearing, dental, and emotional behavioral. Initial screenings are conducted at the onset to establish a baseline for the child's health and developmental status. Initial screenings indicate the first time an EPSDT screening is performed on a recipient by an EPSDT screening provider. The following procedure codes should be used when billing initial screening services. Periodic screenings are well child visits performed based on a periodicity schedule. The ages to be screened are 1 month, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 24 months, and then annually beginning with the child's 3rd birthday. Medicaid will reimburse for only 1 screening per calendar year for children over the age of 3. This schedule is based upon the recommendations of the American Academy of Pediatrics. The following procedure codes should be used when billing periodic screening services. Now, before we finish discussing periodic screenings, let's review some critical components of screenings. The critical components of screenings include a comprehensive, unclothed, head-to-toe assessment, a comprehensive family medical history, immunization status, laboratory results, an age-appropriate developmental assessment is required at each screening. Their nutritional status must be assessed at each screening visit. Health education and counseling for the parents or guardian and the child, if age appropriate, are required at each screening visit. Health education is designed to assist the parent in understanding what to expect in terms of development. Health education also provides information about the benefits of healthy lifestyles and practices, as well as accident and disease prevention. A subjective screening for visual problems must be performed on children from birth through age 2 by history and observation. A subjective screening for hearing problems must be performed on children from birth through age 4 by history and observation. Dental screenings must be performed on children from birth through age 2 by observation and inspection, and history. Beginning with age 1, recipients must either be under the care of a dentist or referred to a dentist for dental care. And lastly, a Medicaid eligible child who has received an EPSDT screening may receive additional medically necessary health care. These services are considered above the normal benefit limitations and require a referral from an EPSDT screening provider. Refer to Appendix A of the Alabama Medicaid Provider Billing Manual for a detailed list of the critical components of health screenings. Some important notes: periodic screenings, also known as well child visit, and interperiodic screenings, also known as sick child visits, are billable on the same day with an EPSDT screening by the same provider or provider group. For example, if a child comes into the clinic sick, treat their illness and catch them up on their screenings as appropriate. An H&H is part of the screening reimbursement and should not be billed separately. And lastly, EPSDT recipients under 18 years of age are not subject to copayments. Now back to complete our discussion on periodic screenings. If a periodic screening has not been performed on time according to the periodicity schedule, for an instance, if the 2-month periodic screening was missed, then a screening may be performed at an in-between age, for example, at 3 months, and then billed as a periodic screening. In other words, the child should be brought up to date on his or her screening according to his or her age on the periodicity schedule. Annual periodic screenings beginning the recipient's 3rd birthday and are only reimbursable once during a calendar year for children over the age of 3. Screenings that are performed more frequently or at different intervals than the established periodicity schedules are called interperiodic screenings. Interperiodic screenings are considered problem-focused and abnormal. These are performed when medically necessary for undiagnosed conditions outside the established periodicity schedule and can occur at any age. If a suspected problem manifests itself, regardless of whether such services coincide with the periodicity schedule, an interperiodic screening should be scheduled and the child's physician so a history and problem-focused physical exam can be obtained and if needed, an EPSDT referral issued to the appropriate specialist. The documentation requirements for interperiodic screenings include consent, medical surgical history update, problem-focused physical examination, and anticipatory guidance and counseling related to the diagnosis made. The following procedure codes should be used with the EP modifier when billing interperiodic screenings. Appending the EP modifier to claims filed for EPSDT-related services allows the visits to not count towards the annual office visit limit. Effective October 1st, 2023, reimbursement rates for interperiodic codes utilizing an EP modifier was changed to equal the reimbursement rates for the corresponding interperiodic codes that are not related to the EPSDT services. Please see Appendix A, Section A.3.6, subsection titled Interperiodic Screening of the Alabama Medicaid Provider Billing Manual for more information. Follow-up visits should be billed using the appropriate interperiodic visit codes 99211 through 99215 with the appropriate diagnosis codes and utilizing the appropriate EPSDT indicator on the claim form. Refer to Chapter 5, Filing Claims, of the Alabama Medicaid Provider Billing Manual for detailed information. Per federal guidance, the public health emergency related to COVID-19 ended on May 11, 2023. Effective June 1st, 2023, Medicaid resumed the EPSDT referral requirement for children ages 0 through 20 years of age. Adult Medicaid recipients, ages 21 years and up, do not require a primary care physician referral to see specialists. However, It may be the policy of some specialty provider clinics to require a referral from a PCP prior to rendering services. Please verify the referral policy with your provider prior to scheduling an appointment. Once the child has an EPSDT screening, all subsequent visits to other providers for further diagnosis or treatment must have an EPSDT referral Form 362 from their screening provider. This form can be obtained by accessing Medicaid's website. Refer to Appendix A, EPSDT of the Alabama Medicaid Provider Billing Manual for more information. The following instructions describes the information that must be entered in each of the block numbers on the CMS 1500 claim form when filing claims as EPSDT referred. In Block 17, enter the name of the referring provider. In Block 17B, enter the referring provider's 10-digit NPI number. In Block 24H, enter a 1 to indicate EPSDT referred service. When filing claims using the PES software, please refer to the Provider Electronic Solutions User Manual for the appropriate claim filing instructions and values. In the field titled Referring Physician, enter the screening provider's 10-digit NPI number. In the field titled EPSDT Refer, please enter Yes for EPSDT-related services. Providers can obtain Provider Electronic Solutions software from Gainwell free of charge. Screening visits are available either as the result of an EPSDT referral or as a result of a request or a need by the recipient. A subjective screening for visual problems must be performed on children from birth through age 2 by history and observation. Objective testing begins at age 3. Visual acuity screening must be performed through the use of the Snellen test, Allen cards, photorefraction, or their equivalent. Objective testing must be referred out if not performed by the screening provider. Vision screenings are limited to 1 each annually. However, if a suspected vision problem should manifest itself, an interperiodic screening should be performed in order for an EPSDT referral to be issued to a specialist. For detailed information pertaining to the vision program, refer to Chapter 15, Eye Care Services, in the Alabama Medicaid Providers Billing Manual. Hearing screenings are available either as the result of an EPSDT referral or as the result of a request or a need by the recipient. A subjective screening for hearing problems must be performed on children from birth through age 4 by history and observation. Gross examination should be documented as grossly normal or abnormal. Objective testing begins at age 5. Hearing screenings must be performed through the use of a pure tone odometer at 500 and 4,000 hertz at 25 decibels for both ears. If a child fails to respond at either frequency in either ear, a complete audiogram must be done. Hearing screenings are limited to 1 each annually, beginning at age 5. For detailed information pertaining to the hearing program, refer to Chapter 10, Audiology Hearing Services in the Alabama Medicaid Provider Billing Manual. The following procedure codes should be used when billing hearing and vision screenings. Dental care is limited to Medicaid-eligible individuals who are eligible for treatment under the EPSDT program. Beginning at age 1, recipients must be either under the care of a dentist or referred to a dentist for dental care, and providers should educate and document that caretakers have been advised on the importance of good oral health care and the need to make a dental appointment. For detailed information pertaining to the dental program, refer to Chapter 13, Dentist, in the Alabama Medicaid Providers Billing Manual. The following procedure codes should be used when billing dental screenings. The first look assessment and varnish programs should be incorporated into the well-child visit and is part of a comprehensive oral evaluation for patients ages 6 months through 35 months. The medical provider and staff must be trained in oral health risk assessment, anticipatory guidance, and fluoride varnish application. Upon successfully completion of the first look training program, the provider will need to submit an electronic enrollment update and attach a request for adding specialty type 274 to the location needed. The following procedure codes should be used when billing first look services. The following EPSDT services are deliverable via a telemedicine visit. Providers must have the specialty type 931 to bill for telemedicine services rendered. Refer to Chapter 112, Telemedicine Service of the Alabama Medicaid Provider Billing Manual for general benefit information and limitations. Reimbursement will only be made for eligible Medicaid recipients. Eligibility and benefit limits should be verified prior to rendering services to any Medicaid recipient. Providers may use various resources to verify recipient eligibility. Provider electronic solution software, software developed by the provider's billing service using specifications provided by Gainwell, the automated voice response system, AVRS, at 1-800-727-7848 by contacting the Gainwell Provider Assistance Center at 1-800-688-7989 or by using the web portal at the website listed below. For detailed information pertaining to verifying eligibility, refer to Chapter 3, Verifying Recipient Eligibility in the Alabama Medicaid Provider Billing Manual. ACHN care coordinators may receive referrals from physicians and dentists regarding medically at-risk clients who need assistance with keeping appointments and obtaining follow-up care. For care coordination services provided by the ACHNs, please refer to Medicaid Provider Billing Manual, Chapter 40, page 40-2. Some services provided may not be listed. ACHN care coordination services are available by contacting your 7 regional ACHN entities via the website below. The Alabama Department of Public Health, ADPH, is responsible for administrative oversight of the newborn screening program. Infants are screened for 32 primary and 45 secondary disorders, which include endocrine disorders, cystic fibrosis, sickle cell disease, hearing loss, metabolic disorders, severe combined immunodeficiency, spinal muscular atrophy, and critical congenital heart disease through pulse oximetry screening. The Alabama Newborn Screening website has a complete list of disorders available on the website below. The definition of a child eligible for early intervention services include infants and toddlers under age 3 who are either experiencing developmental delay equal to or greater than 25% as measured by appropriate diagnostic instruments and procedures in one or more of the following areas: cognitive development, physical development, communication development, social or emotional development, and adaptive development. Or have a diagnosis, physical or mental condition, which has a high probability of resulting in developmental delay. EPSDT referral form 362 is available on our website at www.medicaid.alabama.gov. In an effort to increase the immunization levels of Alabama's children by 2 years of age, the Alabama Department of Public Health and the Alabama Medicaid Agency implemented the Vaccines for Children (VFC) program on October 1st, 1994. This nationally sponsored program offers free vaccines to family and general practitioners, pediatricians, hospitals, nurseries, emergency rooms, and other qualified providers for children age 18 years and under who are Medicaid enrolled and eligible, have no health insurance, are American Indian or Alaska Native, or underinsured. An administrative fee of $8 per injection will be paid for the recipients 18 years or younger. The Alabama Department of Public Health is the lead agency in administering the VFC program. Enrollment and vaccine order forms are available through the Immunization Division. Questions regarding enrollment should be directed to the VFC coordinator at 1-800-469-4599. This concludes the EPSDT Fundamentals presentation. For additional information regarding the EPSDT program, visit the Alabama Medicaid website at www.medicaid.alabama.gov. Select Programs from the top of the web page, then select EPSDT under Medical Services from the drop-down tab.